Hi, I'm Dr. Amie Napier from Medical City, Dallas, Texas. I'm a board-certified OB-GYN and I've been in practice for 13 years. I did my residency at Parkland Hospital in Dallas. My special interests include robotic and minimally invasive gynecologic surgery. Let's talk about fibroids. What are fibroids and what causes them? Fibroids are benign tumors of the uterus or womb. They are very common, occurring in up to 40% of women over 40. Fibroids are the result of degeneration of smooth muscle cells. They can run in families, and there is nothing you can do to prevent them. You can thank your mom for that. What are the symptoms of fibroids? Fibroids cause symptoms such as heavy bleeding, menstrual cramps, breakthrough bleeding, or bleeding in between your periods or outside of the regular menstrual cycle, low back pain, pelvic pressure, and sometimes miscarriage. If they are large enough, they can cause symptoms like pregnancy, including frequent urination, abdominal distension, and bloating. How are fibroids diagnosed? Fibroids are usually diagnosed by the doctor based on an enlarged or irregular uterus noted on exam, or suspected based on the patient's symptoms. They can be diagnosed by a gynecologic ultrasound. Unless the fibroids are very large, a vaginal ultrasound or sono is usually done. Fibroids are frequently noted during a routine ultrasound for pregnancy. They tend to grow as the pregnant uterus grows. Are there different kinds of fibroids? There are three basic kinds of fibroids. The submucosal fibroids affect the lining of the uterus or endometrium. They typically cause abnormal or heavy bleeding and may result in miscarriage. Intramural fibroids are in the muscle of the uterus, or the middle layer. These fibroids usually are responsible for bad cramps. Subserosal fibroids are stuck on the outside of the uterus. They usually don't tend to cause any symptoms. They are the easiest to palpate on pelvic exam. What non-surgery treatments are available for fibroids? Fibroids can only be removed through surgery, but many times their symptoms can be controlled with birth control pills, hormone-releasing IUDs, or hormone injections. They can also be treated by having their blood supply cut off. This is done via a procedure done by an interventional radiologist called embolization. In the near future, we expect to have some exciting new medications to help treat fibroids. What surgical treatments are available for fibroids? Surgery is the only way to permanently remove fibroids. A myomectomy is a procedure where individual fibroids are removed. This is usually done in women who want to retain their fertility, since these fibroids can grow back years later. There are 4 ways to surgically remove fibroids. The first is an open or big incision procedure. The second is a laparoscopic or minimally invasive surgery. The third is robotic-assisted laparoscopy, and the fourth is hysteroscopy. Hysteroscopy can only be done for submucosal fibroids. Women who do not desire fertility and don't ever want to have to deal with fibroids again will often consider a hysterectomy. This is a procedure where the uterus or the source of the fibroids is removed. A woman who has had a hysterectomy will never be able to have a baby. She will also never have bleeding or cramping again. If there are no symptoms, do fibroids need to be removed? I like to tell my patients that your fibroids are only a problem if they're a problem for you. This means we don't need to remove them if they are not causing you any symptoms. Many women live with their fibroids. If a patient can get to menopause, most of their fibroid symptoms will go away. If you're in your late 40s or early 50s, you may want to consider having your doctor draw an FSH, or a menopausal hormone level, to see how close to menopause you are. Do this before considering a big surgery like a hysterectomy. Women with fibroids should get annual pelvic exams. If your physician feels like the fibroids are getting bigger, he or she may order another pelvic sono to check on them. Physicians worry about fibroids that enlarge after menopause, so be sure to continue with your annual pelvic examinations.